All this whitening talk, what do? I just want to make the patient's teeth brighter and whiter. So what am I doing? What are the choices? Oh my gosh, like so much to think about. So there's 4 choices you're going to have. You can go old school. You can go Zoom, okay? 20 to 30 minutes worth of prep time, 2 hours in the chair, zingers afterwards. Cost to the patient somewhere between $500 and $700. Okay, that's a deal breaker for me. I don't want to hurt the patients, and I don't want to hurt their pocketbook. You have something like core whitening. Yeah, their teeth are going to get nice and white. The cost to the patient is going to be over $1,000. Where are you going to get patients to spend $1,000 to get their teeth white like that? Yeah, it's kind of a good idea in an academic sense, but the idea that you're going to get patients on a regular basis do that, not very often. And then, of course, you have the over-the-counter products, the kind of stuff that you can buy at Walgreens or Costco, the Crest White Strips. Yes, they're going to get their patients' teeth white and bright eventually, but it takes them a lot of time. They got to buy a number of kits, and it takes an enormous amount of discipline. At least in my patient population, I don't have those disciplined patients. They want instant gratification. They want to leave the office with a bright white smile. They don't want to spend a lot of money on it, and they want to be able to maintain it. They want continued care with no additional charge. The only option that you have is a hybrid system. The first 3 are not going to work for your dental practice. And if you're not doing between 20 and 30 whitenings per month in your practice, there's a reason why. Too expensive, hurts too much, or the patients are going someplace else to buy this product. When you switch to a hybrid system, all of a sudden 20 to 30 whitenings per month, that is exactly what your goal is supposed to be. So go hybrid and you're not going to regret it. So what is a hybrid system? We've heard so much talk about this. A hybrid system is taking all the good things of whitening and leaving all the bad things behind. So what are the good things of a whitening? Well, we want the patient to have a brighter, whiter smile. That's like rule 1, okay? We want it to be inexpensive to the patients. We want it to be inexpensive to the office. And the difference between the cost of the office and the cost of the patient has to have enough profit inside there to make it worth the office's time. But we also want to think a little bit past that. We want to make sure that it's something convenient and easy to use, not only for the office team, the hygienists and the dental assistants, but we also want it to be easy for the patients. Not a lot of prep time, not a whole big 30-minute Zoom procedure. We want to make sure that the product itself doesn't hurt the patient. We don't want to hurt the patient in their mouth with zingers. We don't want to hurt the patient in their wallet. It's even a worse zinger in a lot of ways. That's what a hybrid system is, taking all the good stuff that whitening's been able to teach us over all the decades and eliminating everything before. So how does the hybrid system work with respect to continued care? What are they taking home with them? Well, the tray that they use in the office to get their teeth brighter and whiter, they take that tray home with them, and now they're going to use the take-home pen, paint the bleach on top of their teeth, put the hybrid tray inside there, and they're going to wear it for 20 minutes, about the time it takes them to watch one television show in the evening. Or if they decided to jump into the shower, they're going to paint their teeth with the pen, put the tray inside there. By the time they do everything inside the shower, they get out, they're going to rinse their mouth, voila! They've been able to allow continued care of their brighter and whiter smile. So you can see that the hybrid system is an in-office system. It's continued care with a take-home pen at a price that's affordable to the patient, at a price that still allows a profit margin for the office with no pain or sensitivity, and it's so easy to use inside an office that it's not a lot of chair time. It's not like a 3 or 4 hour Zoom procedure, and there's no appointments where the patient's got to come back. That's what the hybrid system is. Those wonderful components, taking the good from whitening and leaving the bad behind. And that's exactly where your office should be. And that's how you're going to have 20 to 30 whitenings per month. And you're going to have very, very satisfied patients.